Low sodium diet is important because it's been the key factor to reduce the risk of cardiovascular diseases, and that's related to the association between low sodium and the reduction of the blood pressure, which treat the high blood pressure problem. Generally speaking, we always advise the patient to consider low sodium even if you are healthy. And the reason is, on the long term, there is a higher chance of developing high blood pressure. And actually, with the recent guidelines, believe it or not, 1/3 of the population of the United States are by definition hypertension. So I think considering not to add a lot of salt to your daily food is a good habit. And definitely for those with heart disease, stroke, or high blood pressure, that's, I think, a must, because that will reduce the risk of having further cardiovascular events. Low sodium diet can reverse the problem of hypertension and high blood pressure. And the reason how that happens is reducing the salt would reduce the blood pressure reading, and then you're reducing your high blood pressure, and that's the definition of hypertension. The magic number, that just to make it easy on the patient, is less than 2 grams of salt, which is basically 1 teaspoon of a salt a day. That's where we are suggesting for a patient with cardiovascular disease. So that will be 2,000 milligrams if you want to take it in that content, because the 1,000 gram is basically 1,000 milligrams. So the rule is 2,000 milligrams, just to make it easier, or 1 teaspoon. Symptoms that indicate that the patient is taking too much salt may include noticing that there is more swelling in the leg than usual, having shortness of breath, or just feeling tired and discomfort. And when the patient checked their blood pressure, they found that their blood pressure is elevated. Foods like vegetables, foods like grains and green food, that definitely has less salt than the meaty food and the food that we buy from fast food places where there is a lot of salt already have a place in that. Canned food also contain a lot of salt in general, and the reason is they use the salt to prevent the bacterial growth. So the concentration of the salt is generally higher in the canned food. I would say the good resources to go with the low sodium diet, to have a variety of a little bit of green and boiled meat instead of fried meat that have a lot of salt in general. At the same time, consider greenery, broccolis, and food that tastes good. One of the advice that I give to my patients, because every patient look for a taste, and I would say put a little bit of a garlic powder instead of a salt. It will give you that taste without making your blood pressure goes high, but make sure your garlic is not the garlic mixed with the salt. Pick the one that's pure garlic. A little bit of it on your broccoli, for example, can give you the taste that you're looking for without getting your blood pressure elevated. A good source for a list of low salt diet can be found in the United States Department of Health and Human Services, which have a nice list of what you need to consider when you're buying low salt food, and they divided them by vegetables and seeds and others, and that's I would suggest patients to go and look into for that reason.